You go ahead and go live. I'm going to do YouTube after. We're live.
Okay, good morning, everyone. It is April 30th, 2024, 8:02 a.m. My name is Deanna Diamore. I'm going to call the Board of Health meeting to order. Present, we have Frank Ehrlich, Joan McNeil, Ken Lalim, Terry Quell, Janet Karpiak, and Norman Weinberger, who are all our Board of Health members. We have everybody present. We have staff members, Megan Fogno, Darlene Hoffler, Teresa Argandesi, Brian Weeks, who are also present. So our first item on the agenda is the approval of the March 26, 2024 meeting minutes. Do I have a motion?
Yes.
Thank you. Do we have a second?
I'll second it.
Thank you. Any discussion on the minutes? Any questions? Right. Hearing none. All those in favor of approving the minutes, say aye.
Aye.
Any opposed? Abstentions? All right, minutes passed unanimously. Thank you. The second item is a discussion and review of our active TB policy. And to give an overview of that policy, we have Darlene Hoffler, who is our supervisor of clinical services. So I'm going to pass it on to Darlene.
Good morning, everyone. And hopefully you had the opportunity to review the updated policy. And most recently, we made some language changes to sort of broaden the designations of who does what in this policy versus being so specific. Opened it up just a little bit. And then we also updated the definition of our directly observed therapy definition to include electronic monitoring with the pandemic, or just, that we actually ended up using video DOT much more often than home visits. So that's been pretty much the standard going forward. We also updated some of the appendices to reflect the newer forms that are being used. Those are most of the, and we added a flow chart of the activities of the way that the process works. I know, Terry, you had a lot of comments and observations, and I appreciate that. Sometimes it takes some fresh eyes to look at it and see some of the mistakes. Do you want me to go through some of it in response to your questions?
I don't really feel the need. Some of it was just kind of procedural. Like I saw a couple of places that said mail or fax something, and probably you can include email, because I don't know that anybody's mailing anything anymore. But I know that's probably just old language. I did have a question about the screening titles. There were two screening tests that were almost exactly the same that I thought maybe you want to, I think it was two appendices. They both said, H&I said tuberculosis screening test protocol.
Mm-hmm.
So I just thought you might want to rename one of those.
Mm-hmm.
And then the other question I had was about the, there was an older reference there that was, had really old references of its own that probably needs to be updated. I don't know that it's the most current one, but other than that, I think it was just, I'm just looking through my notes. Wasn't anything really significant, mostly just how does the procedure work? What do you tell a patient if they do have to give their name? I didn't see a note for that. So just if you have somebody new. And then I wondered who orders the chest x-rays?
Well, it depends. It depends. If they're coming through our program, we will order it. If they have private insurance, they go through their primary. And we get information from the physician.
So can you order a chest x-ray, or is that something a physician needs to do? I have absolutely no idea.
It's definitely a physician, nurse practitioner, PA, that does the ordering.
Okay, so your nurse practitioner could probably do it. Okay, great. Okay.
And just in response to your suggestion of using email, it's not always the most secure way to send information. So the state would prefer that we mail things to them.
Really?
Ask them, yes.
Oh, interesting. Okay.
They have their own security, set up, but we can't always access.
Yeah,
Communication.
yeah, okay. Yeah, so you can just look through those comments and some of, it was just something clarification that I just had question, like, how does that, what happens next? So,
I appreciate that. Thank you. We'll definitely review it and make some updates.
great.
Anyone else have any questions regarding the policy?
No, I think I'm good with it.
Thank you.
Thank you, Darlene.
Thanks,
Good
Darlene. I
work.
know, yeah. And there's a lot of different dependencies to that. I know Aniela helped, and then Brian also took a review of it too, and we added a reference to EPI division now. I think we have EPI division. And thank you, Terry, for your thorough review and all your questions and comments. Do you want us to come back when we make edits, or do you want to think about adopting the policy revisions with making some of those additional changes or answering some of those questions that Terry posed? It's a question to the board.
I like the second thing you said. Approve it today with the revisions pending.
Okay.
Absolutely.
Yeah, I'm fine with that.
Great. I do have one question, just for my own information. Approximately how many cases of TB does Norwalk see annually?
On average, it would be around 3.
3.
Mhm. I mean, recently we had up to 5, but on average, it usually falls about 3 cases a year.
Thank you.
You're welcome.
Any other questions? All right, so I'm gonna call for a vote for adopting the active TB policy revisions with additional revisions based on Terry's feedback. Do I have a
So
motion?
moved.
Norman?
I'll
I have a second.
second.
Terry, thank you. All those in favor, say aye.
Aye.
Opposed, abstentions. All right. It passes. Thank you. And thank you very much, Darlene. Next item on the agenda is our rapid community assessment, and we have Megan on to give a good overview of this really great initiative.
Good morning, everybody.
Morning.
Sorry, I have too many boxes open.
Megan, you're coming out really low to me, their volume. I don't know if anybody else
I'll
having
try to
heard.
speak louder. Is this better?
Yeah, thank you.
It's first thing in the morning. My voice is still not there. So I'm going to be, presenting today about the rapid community assessment that the health department has been conducting last week and this week. And so the reason why we're conducting this is that we received a grant, the immunization and vaccination for children COVID-19 supplementary funding. It's a grant from the state through the CDC. The grant period, the executed contract we received was December of 2023, and this grant goes until June of 2025. Conducting a rapid community assessment, or RCA, is one of the deliverables of the grant. And so this is what we've been doing the last week. And so what is our RCA? Some of you guys, I'm sure you guys know, but a rapid community assessment is a process for quickly collecting community insight about a public health issue to inform program design. The assessment involves reviewing existing data, conducting community-based interviews, listening sessions, observations, social listening, and surveys. This is our health department team. We have a wide range of staff: Brian, Teresa, Corey, Pam, Sarah, Hillary, Jalea, Kelly, Ashley, myself, Omar, who's our new community health worker, and Sherry. So we actually have across the whole department somebody from almost each of the divisions participating in some part of the process. So again, these are part of our grant deliverables. So we have to, conduct the community assessment, through listening sessions and surveys.
Hey, how
We-
are you? Okay,
We also have to then create a written report or narrative, a one-page summary, a PowerPoint presentation with a summary of the findings. We have to identify priorities out of the RCA, and then work on solutions and develop educational and outreach programs to address those RCA findings. The report that we'll create, we'll share with the community as well as the board. We'll also share it back with DPH. And going forward, I'll talk to you when we're going to be doing that. So these are just kind of 5 steps of a rapid community assessment. So one is to identify objectives and the communities of focus. Based on this grant and based on what we felt the needs of the community were, we decided to focus on children immunizations, so childhood vaccinations. And so we started to plan for the assessment, building our team, training everybody, making sure everybody was knowledgeable of what data was currently out there. So Brian and his team, weeks prior, presented to us some of the current data in the community that we had access to. And then we moved forward into planning the actual assessment. So reaching out to community partners, providers, folks in the community that we could go out and have listening sessions at their organizations, interview key informants. And so really get out into the community last week and this week to really promote this RCA work. Step 3, that's where we are right now, collecting and analyzing data. So right now we're in the field of collecting it. As of yesterday, we had over 70 surveys completed throughout the community. So we've been promoting those surveys on social media. Our community health worker has been out in the field last week promoting the survey, trying to get people to take the survey. And then this week, we've been doing a lot of key informant interviews. So those are short conversations where we're trying to gauge people's insight and knowledge and feedback around this topic area. Step 4 will start right after the end of this week, where we start reviewing the findings, summarizing them, and then identifying solutions. And then obviously we will be evaluating our effectiveness after this whole process. And an RCA can really be for any public health issue that we're interested in finding more insight about. This is one of the first ones we've done. It's almost like a pilot for us. And it's been a really great process this far. These are just some resources that are out. So the CDC has a whole guide on how to conduct a rapid community assessment. And so this was something that our team and myself reviewed before we started the whole process. And this is really helpful. Besides this, we're also working with the Yale Griffin Prevention organization. And so they're assisting us with debriefs each day. They're also assisting with our data collection efforts. And so we're working really closely with them. Kind of just a timeline. I kind of mentioned this, but it's a few week process. Really, the RCA is supposed to be conducted within 1 week. It's a really rapid. So you're out there every single day, talking to people, collecting this data. And then each afternoon, we're doing debriefs with Yale. So it's a lot of, we're very busy. So if you follow us on social media, which I know you guys do, if you have that, you'll see the survey that we've been promoting. I'm going to leave this up for a few minutes. If anybody is watching at home and they want to scan this QR code, you can take this survey. So if you don't see us in the community, but you still want to participate, you're able to scan this QR code with your phone and it brings you to a survey. It's an anonymous survey. So you can, not worry that it's going to be tied to you, but an anonymous survey. It will take you 5 minutes and it's really to gauge your opinions on vaccinations for children. And, we're looking for information from the community to gauge if there's barriers or obstacles in getting children vaccinated. And so that's what we're really trying to look at. So then we can build programs to address those barriers. The survey is in English and in Spanish. And it will be open until May 4th. This is Omar. He's our community health worker. He's been out in the community. We've gone to preschool providers. We're going to the libraries. We've gone to doctor's offices. And so he's out there letting folks know about the COVID-19 vaccine, but also promoting the survey and doing listening sessions. this was one of our listening sessions. We saw, I think close to 15 families. And so we engaged with conversation with them. And it was a really great event. This was actually last week during National Infant Immunization Week. So Pam Bates and her IAP team were out there with us. And it was a great event there. And then lastly, we've been conducting key informant interviews this week. So speaking with community members, we spoke with Norwalk Public Schools, providers, and childcare providers, to name a few.
Mm,
Any questions?
this is good.
Thank you, Megan. That's a lot of really, really great work, and it's wonderful to see all the staff members involved too. You're doing such a great job organizing this whole event, 2-week event.
Yeah, so if there's, once we complete it, I will report back. I'll probably present again, or Deanna will share the final report with you all. So we'll be able to see some of the things that community members are sharing with us. Thus far, it's been really interesting, some of the barriers people are seeing or their perspectives around childhood vaccination. So, you know, then we'll be able to see what work we can do to conquer those.
Thank you.
Thank you, Megan. Next, we have our epidemiology updates. So I'm going to pass it on to Brian. Good morning, Brian.
Hey, good morning, Deanna. Good morning, board, and everybody else. So it's just gonna be a really quick update. More or less, we're in a good spot with the respiratory illness season situation. So let me just pull up the screen. You know, more or less the breakdown for Fairfield County is flu, RSV, COVID-19 are decreasing. And I'll just jump right over to the levels of respiratory illness activity. So this is the syndromic surveillance. Again, people go into the emergency department for, fever, cough, anything that kind of meets the criteria for respiratory illness. And right now, as you can see, most of it's kind of in the green in the country. Maybe little parts of the Southwest or the West Coast or the Midwest, maybe experiencing a little bit moderate activity. But fortunately for most of the Northeast, it's minimal. Maybe Massachusetts being just a little bit higher, at the low level. But nonetheless, a good situation given the fact that we're moving more into spring, and then with the warmer weather, especially with yesterday, right? And then, with the emergency department visits for just more specifically Connecticut and Fairfield County, what you see here, the blue is flu, and the orange is COVID-19, and then RSV is obviously this like purplish pinkish. So RSV is kind of like at baseline levels. COVID's almost pretty much at, baseline levels. Flu's making its way there, but it's only at about 2% of emergency department visits. So we're doing well. It's just, it's still some respiratory illness activity in Fairfield County, but, very, very low activity. So overall, good situation with that. And then with that said, I'll jump over really quickly to the CDC Health Alert Network message about highly pathogenic avian influenza, or HPAI. For influenza type A H5N1. We obviously been seeing this in the news a lot, so I just want to kind of cover it really quickly because it ties to the whole respiratory illness situation. Fortunately, again, we're getting into more of the spring weather and eventually the summer weather, so transmission of flu should be decreased. Nonetheless, there's obviously opportunities for exposure relative to H5N1, and that is more predominantly in, farm workers or those that are processing, dairy or poultry. So it is mostly wildlife or birds, dairy cows right now, and again, poultry, so like chickens, that are raised for eggs or for whatever odd reason. And so again, this is a bigger issue right now, more from maybe the South and Midwest, but other places that would have farms. I mean, keep in mind that even in Connecticut, we have farms here too. And so limiting the exposure, whether it's, occupationally or recreationally too. So especially, wildlife, somebody's kind of, runs into a sick looking bird on the side, again, it's just applying common sense rules here. So more or less taking those proper precautions, wearing the proper protection, especially relative to the occupational needs, following up obviously with a healthcare provider if anybody suspects that they have any respiratory illness, especially if they came in contact with wildlife or any sort of occupational interaction with the animals and livestock. Right now, there's only been one human case this year, and that was in Texas, and it was mostly just mild presentation. And so we want to just kind of be ready for that in terms of limiting the opportunities for animal to human transmission, which then subsequently, should there be further mutations, creates the opportunity for human to human transmission. So we just want to mitigate these things overall. So risk to the public's very low right now, but it is a situation we are closely monitoring. Just wanted to address it because it's in the news quite a bit. But again, it's just really applying that common sense in terms of limiting one's exposure, especially, that includes, again, the birds, dairy cows, things of that nature. So I just wanted to mention that. And then shifting gears to the other CDC Health Alert Network message, because we've been getting a lot of those just with this year. And that's the adverse effects linked to counterfeit or mishandled botulinum toxin injections, or Botox. And so there's been about 22 people in 11 US states, which also includes New York and New Jersey. This has all been females and within the age range of 25 to 59 years old. And this is going to non-healthcare cosmetic settings, whether at home or like cosmetic spas, places like that. So just wanted to share that as just, because it's in the region in terms of risk, and everybody should do their due diligence in terms of when they seek out these kind of injections, doing, the research in terms of just making sure it's a legitimate place, it's licensed, the provider's license, doing it in a healthcare setting would be optimal. And things of that nature. So just being mindful of that. But should anybody start presenting with any symptoms that related to botulism, again, paralysis is the big thing. Obviously seeking emergency healthcare right away. And then there will be steps that the local health department and the state health department follows in terms of, getting the antitoxin and, providing additional guidance. So just wanted to mention that as well. So those are my updates. Thanks.
Brian, Brian,
Yes.
just a question. Any changes in measles?
So there still are, measles cases that are popping up here and there, but fortunately for Norwalk, no change. Yes. So that's the good news for us. But, still we have those sporadic cases that are popping up that create opportunities that can make its way here. And so we've done internal exercises to prepare ourselves in terms of what the process would be. A lot of other local health departments too in Connecticut have prepared themselves and done exercises as well. We're all very much on high alert. Fortunately, most of April's passed, and as you know, I mentioned in the past that April's kind of a concerning month. Nonetheless, we still have all the other months to consider and be prepared for measles because it could pop up at any time. So we're ready to respond. And it's great that we had that health alert network message related to measles as well. So I don't have the screen share right now, but I had that CDC Health Alert Network message up because, again, that was one that was released in March. So we're very prepared. So thanks for the question, but fortunately, nothing's popped up. Knock on wood.
Great. Thank you.
Thanks, Brian. Does anybody else have any questions for Brian?
So thank you for the update.
Okay, we have director's report is next. And so we're talking about spring and Megan mentioned some of the outreach. We just have a lot of events that the health department is participating in and assisting with. So I just wanted to highlight some of them. This past weekend, there was the Earth Day Festival. And so Julia, who is our health education associate, she hosted a walk with Nancy Rosette, who's a former chair of the Bike Walk Commission. So they organized a walk and promoted the Norwalker program that we have. Julia and Kelly, who you met last month, our health educator, they both had a table during the event and they spoke. So I just want to thank both of them for participating in that and for assisting with the event. I've heard that it was really successful, a lot of turnout in the community, and just a really well-favored event. We also are participating, there's going to be an open streets event that the Bike Walk Commission is organizing that's being held this Saturday from 9 to 1 at Calf Pasture Beach. It's going to have a variety of fitness and fun activities for families to enjoy the car-free environment. And so we will also be participating in that. And then there's also the Norwalk for Mental Health Walk that's happening on May 4th at the Norwalk Green, and the health department's also participating and has been assisting with, promoting that event. So just wanted to highlight those events that have happened or are happening. There's a lot of activity, and it's great that our staff are getting out there and helping to support them, getting out in the community.
Yeah, that's good.
That was my quick update. Does anybody have any questions? All right, well then our last item on the agenda is public participation, but I don't see anybody from the public. So I don't think we have any, so I'm gonna close public participation. Before we wrap up today, is there anything else any board members wanted to discuss?
I had a quick question that was posed to me. I didn't know the answer to it. Some sightings of coyotes. One ended up on my neighbor's deck. Little concerned with little kids and a lot of other stuff going on. Any mechanism? Is there a published mechanism to report activity? I didn't know where to send them.
Yeah, I don't know. I can look into that. And the two things that come to mind are, either animal control or DEEP. DEEP keeps track of wildlife. Brian, I don't know if you know the answer to that off the top of your head, but I can look into it to see if there is a formal mechanism for coyotes specifically.
And if you showed up on a camera, with all the cameras and stuff we have out there, more and more of this type of thing is bound to happen. It'd be nice to be able to get back to them.
Okay.
Ken, I had a bobcat on my lower deck. My security camera picked up the bobcat walking across. So I reached out to DEEP and they said truly with wildlife, nothing to do. Just they track the activities. If they're posing any danger, then they'll come in and address the situation. But really nothing to do. So
Yeah,
Go ahead, Brian,
Well,
sorry.
No, sorry, I don't interrupt. I was just gonna follow Deanna's comments. I mean, yeah, really, and Joan, to your point as well, like CT Deep, you can reach out to them as well as Animal Control. And I don't have the ability to add to a chat, so I think what we could do is follow up with just like the website links and phone numbers, if you would like to have that.
That's a great idea, Brian.
DEEP has great information too about, living with coyotes, how to, prevent any issues. And similar to what Joan was saying too, like there's, mechanisms to report problems and animals that are behaving abnormally. But beyond that, I'm not sure, what, but I agree though, let's send that information out as Brian is saying. We can follow up.
yeah, they just told me make sure that I warn my neighbors in case they have like small animals. But yeah.
Thank you.
I had this discussion with a couple of friends who also found a bobcat on their camera. And we were saying that probably these animals have been there for ages, but we didn't have cameras.
That's
So
what
we
they-
didn't know they were there. So, because you don't see them during the day or anything, you're only seeing them on the cameras. So, we were saying, it's probably not necessary to panic that these animals are there. They've probably been there. We just didn't see them.
That's exactly what Deep said. They said the only reports they get is from security cameras.
Mm-hmm. Yeah.
What technology will do for us.
Mm-hmm.
I remember this is a topic that came up, I believe, in some of the, I think when it used to be the Health and Public Safety Committee of the Common Council, I think some of these discussions about coyotes came up. So it's something that comes up every once in a while. It's something that the community is definitely concerned about. So make sure we get the information out there.
Yeah, I would be scared of the coyote. Bobcat, yeah, coyote.
I think someone just mentioned that they're tend to be nocturnal. If you see a coyote during the daytime, you need to, I think, be even more, have more trepidation because that animal might be rabid.
Mhm.
All right, so we will circle back and get that information out to everybody.
Is there a mechanism though to educate the public? Is there, or is that strictly from DEEP?
It is more of a deep function, I think, and more of an animal control function, but I mean, there is information, but I guess, you know, we can always share the information.
Can we recommend to DEEP that they have a community piece of that? I mean, that's education, I think, is the way to go. And our job, I think, is to inform the public that they have resources. And if that means going to DEEP and saying, you do it, that's fine. I'd like to not just drag it around too long.
We have a section of our website that's fact sheets, and we have different resources, information that we publish. And we can always look to, if it's something that the board wants us to do, we can, you know, link to the DEEP's information, because they do have fact sheets. They do have a lot of information already on their website. So how about I send it along to all of you, and then you take a look at it and think about it, and then think about what you know, we want our next steps to be. Does that sound like a good plan?
Yes.
Yeah.
Mhm.
Any other discussion related to this?
One other quick one. I know as we talked about the rapid community assessment, where things are, and we're pretty far down the road there. Is it worthwhile having somebody from the board get on that committee? As a large group of people from lots of different walks in life, if you would. Is that worthwhile? Is that or it's gonna end up being brought to us at some point anyway? Didn't know if involvement at the beginning of that process is worthwhile.
Yeah, so we're conducting key informant interviews, so we are interviewing somebody on the board, but if you'd like to be part of an interview, I can interview you this week. And or if you just want to join the meetings after. So after this week, we'll just be compiling all the data and working on a final report. But if you'd like to be interviewed, it would be anonymous. So you'd be just a community member, or depending on your title. I can reach out to you after the meeting, Ken, if you want.
Sure, that'd be fine. Thanks.
Okay.
Thanks, Megan. Thanks, Ken.
Yes, thank you.
Any other things before we wrap up? All right, well, we will be meeting again in May. If there's any items that you want on the agenda, please reach out and I can add it to the agenda. Hearing nothing else, we will adjourn at 8:35. Have a great day, everyone. Thank
Bye,
you.
everyone.
Bye, thank you.
Bye-bye.
Bye-bye.